You're listening to Honestly Aging by Friends Life Care VigR, a podcast where we explore what it's like getting older, the peaks, the valleys, and everything in between. In this season of Honestly Aging by Friends Life Care VigR, we're covering topics related to vibrant aging. I'm your host, Cheryl Praska. Let's grow old together. On today's episode, I'm joined by Dr. Rachael Thompson, who is a doctor of chiropractic and the owner of Impact Chiropractic, located in Malvern, Pennsylvania. Dr. Rachael attended SUNY College at Oneonta and received her bachelor's in biology with a minor in health and wellness. She went on to receive her doctorate of chiropractic from Life University in Atlanta, Georgia. While in Atlanta, she helped grow one of the largest chiropractic care offices in the Southeast. Now in private practice at Impact Chiropractic, Dr. Rachael strives to bring better health to the community through a natural healing method that is affordable. In her practice, Dr. Rachael strives to provide hope and encouragement to all for a life free of drugs and pain. Dr. Rachael, welcome and thank you for being here. How are you today?
Hi, I am doing great, and thank you so much for having me.
Absolutely. So, Dr. Rachael, you're joining me today to explore how chiropractic care can be a vital part of maintaining health and vitality as we age. To get things started, can you share with us your background and why you're passionate about chiropractic care?
Sure. So I have been getting adjusted for most of my life, honestly. It all started because my dad was suffering with low back pain, and it was really affecting his life. He wasn't able to sit for very long throughout the day, so he started going, and it truly impacted his quality of life. It allowed him to like sit for dinner with us and enjoy time as a family, which is huge. So he got the whole family under care, and I started getting adjusted when I was in middle school, and it was great. At that time, it was just kind of fun because you're in middle school, but I really started liking natural health care, and I at the time did not know, but I had some GI issues, some extreme pain, that kind of thing going on pretty often. And throughout adjustments, I no longer had that issue. So it was just one of those things I didn't think could get cured per se. And I haven't had those pains in 20 years. So it really got me into chiropractic today.
I'm so glad to hear that you were able to get relief, and especially as you're saying, from the more natural methods.
Right. Yeah.
Well, what led you to start your business, Impact Chiropractic?
So when I was in school, I knew that I wanted to have a big mission in my community. I really wanted to impact it, which is why the name is Impact Chiropractic, and really have a different type of office than your typical chiropractic office. One thing is I wanted to do a specific technique, which is called torque release technique. The other thing is I really wanted to focus on pediatrics and pregnancy, which is what I see a lot of. I do see people of all ages, but I also really like to see that demographic. So I knew with that kind of specialty, I wanted to start my own office.
For those out there who might not be familiar, can you explain what chiropractic care is and how it works?
Sure. So chiropractic care is all about the nervous system. So your nervous system is your brain, your spinal cord, and then all the nerves that go to every single cell, tissue, organ in your entire spine, your entire body. And what chiropractic does is it takes pressure off of your nervous system so that your entire body can function the way that it's supposed to. I really like to use the analogy of a cell phone tower and a cell phone. So your brain is your cell phone tower, and every single muscle, organ, tissue in your whole body, those are all the cell phones. If you're not getting good service or reception, it's not going to work great. So you want to make sure that the service, the reception, there's 100% flow between both of them so that your body can heal and you can help with dysfunctions and pains that you may be having.
You mentioned the specific torque release chiropractic technique. Obviously, you said that is what you specialize in and you use at your office. Can you
Right.
explain how that specific technique works?
Sure. So torque release technique is really a modern way of adjusting. There, we use a tool, and there's no popping, cracking, twisting at all in this kind of technique. You get to lay down on the table face down the whole time. It's very relaxing and gentle. So the tool itself looks like this. It has a little eraser kind of tip on the end. So it's very, very gentle, very, very specific in what we're adjusting. I'm just not moving around all sorts of bones and cracking them. It's very, very specific into that specific bone that I need to move to cause the adjustment to happen. I can use it on babies, infants, all the way up to elderly, just because it is so specific and gentle.
I mean, I will share that the impression that I always have had on chiropractic care is what you were previously referencing was with like cracking and twisting and
Sure.
popping. And I mean, it's really enlightening for me to hear that there is another way to go about it.
Sure. Yeah. And you know what? That's honestly, I was adjusted that way my whole life. There's nothing wrong with that. There's many, many techniques in chiropractic. And with this one specifically, it gets really great results. And like I said, it's so gentle. So for people that are maybe afraid that we're going to hurt them, or especially, if you're a little bit older and you have osteoporosis, that kind of thing, and you're really worried about getting adjusted, this is such a great way because it's so gentle and you don't have those concerns.
Would you prefer to age independently in your own home or live in a nursing facility? I know what I'd rather do. Friends Life Care membership offers just that. Plan today for a future lived at home with vitality, independence, growth, and resilience while protecting your savings. Learn about your options at a free seminar or webinar. Register at friendslifecare.org/register or call 215-628-8964. And that's such a nice segue into where I wanted to head next, which is how might chiropractic care support the aging process?
Sure. So, in a couple different ways. So, one, as you age, your disc spaces, which are all the spaces between the bones in your spine and in other areas, they actually lose hydration. They're not as big and plump like when you were younger. So, you have decreased mobility in those areas. And adjustments really help get some motion in those joints. It allows you to stay mobile and limber, as people would say. One of the biggest complaints I have is that you can come in and you can't turn over your shoulder when you're driving, right? You're trying to look over your
Mhm.
shoulder when you're merging or trying to back out of your driveway, and you can't do that anymore. That's a big one. It helps keep that motion in that neck so that you can continue to turn your neck and look side to side. So that's one of the ways. Another is just to help with different issues you might have as you're aging. So a big one might be balance. Adjustments really, really, especially in that neck region, really help with balance and vertigo issues. So I do have a lot of elderly people that just feel so much more stable on their feet and walking because they don't have the upset balance and equilibrium. So those are the two big ways that I see.
And at Friends Life Care, the falls risk reduction is such a big initiative and focus of one of the ways in which we help our members age in place. So, hearing that there is another way to go about helping support the balance through chiropractic care, it will be very informative for our listeners. So, I thank you for bringing that up.
Oh yeah, absolutely. Yes.
So, some people might think that chiropractic care is only for injuries or if they're experiencing back pain. What are some of the other common misconceptions that you might like to address?
Sure. So I will say chiropractic can help with aches and pains. That's kind of what we're known for. Absolutely. Part of that is because when we move those bones back into alignment and take pressure off of your spine and your nerves, it's going to help with the pain that you have. So, yes. But the other thing is that those nerves go to all of your organs in your body. So, stomach, uh, reproductive organs, things like that. So, we do see a lot of people with internal issues. I said GI issues. That's constipation, acid reflux. I see a lot of women with infertility too. Things like that might be going on, that just taking pressure off of those nerves so that you can get full flow from your brain down to your GI can really, really help eliminate and help with those issues. So, yes, we do see people with aches and pains, but honestly, it's really good for your whole body to function better.
And I'm just hearing about it. What I'm envisioning is that, like, the release of pressure. So, knowing where in your body you might hold some of those pressure points or feel tension, having the ability to come in and see you and get that release, I'm starting to just it's crystallizing how it all works together.
Yep. Yeah, that's part of it too. Yeah, absolutely.
What could a new patient of yours expect on, like, their first visit to see you, and then, like, as time goes on?
Sure. So that first visit, one when you come in, we do take insurance here. We do take Medicare. We do take most major insurances. So we always do a benefits check to see, what is covered and what is not. So you know all that up front. That's the big thing. But then also we do a few assessments. So we do two really great scans that show us how your nervous system is functioning and also how your muscles are functioning along your spine. So we do a few assessments. We look at your posture, your range of motion. Um, and this is all, of course, after a normal health consult. So we're going to see what's going on with you too before we do those assessments. And then we'll do your adjustment. From then forward, when you come back on your second visit, we go over recommendations of care and then how often you would need to be coming to see the results and meet all your goals as well.
I have a follow-up question. You mentioned that, there are 2 scans that are performed. Are
Mhm.
you able to share what they are?
Sure. So it's called the Insight technology. So one is a nerve scan. It's looking to see how the nervous system, and it's just a really simple scan up your spine. It like rolls up your back. The other one is of your muscle, and it's called an SEMG. It's kind of the same technology as you would have of your heart. An EKG, except it's looking at the muscles along your spine to see how they are functioning as well. So that also really skin, just really easy, just an assessment on your skin, nothing invasive, anything like that. And then it shows a really cool chart and it shows you what's going on, which we will go over on that day as well.
Yeah, I'm curious, and I'm going a bit off script here. I'm wondering, what do you when people come to see you, do they usually come in because they're experiencing a pain, or they got referred from a doctor? So, like, what is, like, triggering someone to come in and get chiropractic care?
Sure. So most people do have some kind of aches and pains, whether
Okay.
it's low back pains or headache or whatever. That's the main reason. I do have people that come in just because they want what we call wellness care. They want to just make sure that they are aging with grace per se, and they want to maintain health and prevent issues from happening. So those are the two big categories. I really don't get referrals from
Okay.
doctors per se, yeah, but more pain or just because you want to age gracefully.
Do you have any patient stories that might highlight the impact that your chiropractic care could have on an older adult?
Sure, yeah, lots. So my favorite one would be we had this really sweet woman come in. She had vertigo as well as some neck pain going on. Her main complaint was the neck pain. I found
Mhm.
out about the vertigo afterwards, and she really just wanted to improve the pain. Okay, she couldn't turn her neck side to side, had a lot of pain. So after her course of care, after a few visits, she was feeling so much better. She was not having the neck pain. She could turn side to side. We talked about driving. That's a huge one. She could actually turn and look over her shoulder while she was driving. But then also, she didn't have any more vertigo symptoms. And that was something she was shocked at because she didn't realize we could help with that.
So, for listeners who, after hearing this or before, who are considering chiropractic care, what advice would you give to them?
Sure, absolutely try it. It is very, I'll say, painless. It's great to try. It will help you age better. It will help maintain your wellness, keep you mobile for a longer period of time. So definitely give it a shot.
So thank you so much for joining us today. I'm curious whether you have any final thoughts on how chiropractic care can help our listeners age vibrantly, in addition to everything you've said, or just to really drive home something that you want to reiterate.
Sure. So, chiropractic again is great for as you're getting older, but another huge part is that chiropractic care is great from as soon as you can start coming. I do see infants in my office for all sorts of different issues and symptoms, as well as wellness care. So, just, yes, it's great to get care, but the earlier you start, the better for your overall well being.
For our listeners who want to get in touch with you and Impact Chiropractic, where can they learn more?
Sure. So you can go to our website. That is a great option. We are on all different social medias, Instagram and Facebook. But if you can always just give us a call or go to our website.
Thank you so much.
Yeah, thank you.
Thank you for listening to Honestly Aging by Friends Life Care VigR, a unique program focused on aging with vitality, independence, growth, and resilience. You can find links and show notes from today's episode on our website at friendslifecare.org/podcast. Thank you to Dr. Rachael Thompson for joining us today. You can learn more about Dr. Rachael and Impact Chiropractic by visiting goimpactchiro.com, Facebook, Instagram, and LinkedIn. And thank you to Nick Dieterding for editing all the Honestly Aging episodes. If you like our show, please rate, review, subscribe, and join us next time. To learn more about aging with vitality, independence, growth, and resilience, subscribe to our blog at friendslifecare.org/blog.